Welcome back to Guelph Life. Well, we've hit a huge milestone in the fight against COVID as vaccinations have been rolled out in our city. Sarah Ricci, a program manager at the hard hit Shelburne Long Term Care Home, was the first person in Guelph, Wellington, to receive the Pfizer vaccine. Medical Officer of Health Dr. Nicola Mercer says the rollout of the vaccine will be complicated, though, due to the logistics involved. And sure enough, 2 weeks after the first vaccine, the vaccination process had to be put on hold because of delays from Pfizer. But Mercer said everyone who wants a vaccine will get one eventually.
Today represents hope. I think it also represents, though, the sign we have to be patient. We have much to look forward to, but our numbers are really high. All across the province, if those of you who are looking at our website and are tracking, we are seeing the effects currently of people who didn't quite follow the public health rules over Christmas. I do know that many people did. And I do know that many people reduced their contacts over Christmas, but maybe not enough, because the numbers we are seeing are really quite high. So we need to encourage people to be patient, follow the rules. Everyone who wants a vaccine will get a vaccine. The vaccine is going to start to flow. January is going to be tough because there's not going to be enough for everybody who wants it. February, again, there will be a lot of people who are waiting for vaccine who won't be able to get it. But as we get towards the end of February, March, April, you are going to see vaccine being delivered. We're going to try and do so in such a thoughtful way that those who are most at risk are the ones that get it first. Okay, so the question is, when can the general public? So I think that question of the general public is a really loaded question, because most people in the general public don't see themselves as being general public right now. We have all our seniors. We have those over 80, those over 70, those over 65. We have all of those who have underlying medical conditions. They see themselves as vulnerable. We have the people who are essential workers. We have our fire, our police. We have our food service employees. We have the people who keep our, the lights on in our communities. So those are all a large category of people who don't see themselves as the general public. And those will actually be encouraged to be vaccinated sooner as supplies allow. So if I took healthy people, younger people, let's just say healthy people between, for the Pfizer vaccine, 16, for Moderna, 18, so between ages of 16, let's just say 45 or 50, no medical problems, you're well, anticipate that you will be invited to be able to start receiving the vaccine about end of May. That could be plus or minus a few weeks. That's how long it might take. But there's going to be a lot of vaccine that's going up before that. So all of the other categories of workers will be invited to get the vaccine prior to that. And I think one of the reasons why the rollout of the vaccine has been a little slower than what you would see is because the Pfizer vaccine in particular has to be stored in very special freezers. We are fairly unique as a health unit in that we actually do have the storage capacity for this vaccine. So currently behind me, probably about 30, 40 feet behind me somewhere in the depths of our building, we have the capacity to store up to almost 100,000 doses of the Pfizer vaccine. And as of the beginning of next week, we'll have the capacity to store a further 100,000 doses. So that's a significant capacity that we are prepared to receive. I highly doubt we'll get 100,000 doses in a shipment or more. But there may come a time in the coming months when we could receive a fairly large shipment in order to be able to distribute it to our community. The amount of vaccine that we are receiving is quite small. 975 doses were received yesterday. For public health, in our usual practice, we deliver 975 doses easily in one day. The requirements for COVID are a little bit different. Look around the room, we're all spaced apart. We're all wearing masks, some of us are wearing face shields. So as we give these vaccines, we have to take precautions that we didn't have to give in the past. Some of you may have remembered H1N1, some of you are probably a bit too young for that, but some of you who are remembering H1N1, remember standing in long lines, close together. Can't do that for this vaccine. So the logistics of this vaccine, how it's delivered, how it's stored, how we immunize, how we have to book appointments based on priority are really quite complex. So as many of you saw, this is a brand new building. We're really fortunate to have it. It's a beautiful building. This building was built with safety security for vaccines in mind. So we have all of those measures. So right from the way it gets into the building, the number of locked doors. So for you who are coming, you had to come through locked doors to get here today. Our vaccine is behind even more locked doors. We have video camera surveillance, we have alarm systems, we have staff. There are many layers to protect the site of the vaccine. In addition to that, there's the layers that protect the vaccine. So the freezer that the vaccine is held in is monitored. It's not just monitored on site, it's not just alarmed, it's not just that the freezer itself is actually wired into the wall so that plug can't come out. It's on a backup generator. It's remotely monitored. So we have real-time live monitoring of all our vaccines, not just this one. This building and all our buildings are meant to protect the vaccines that we have. They have millions of dollars worth of vaccines at any one point in time outside of COVID. So when you have that kind of inventory, you really need to be careful with it. So I can assure you that the vaccines that we have on site are being well protected and well monitored throughout the process from the time we get it till it's put in the arms of our subjects, of our clients.